Continuing with the pathophysiology of folate deficiency anemia, excessive intake of alcohol leads to absorption of folate in small intestine, which affects DNA synthesis, eventually progressing towards folate anemia. Clinical manifestations include similar signs and symptoms as pernicious anemia, except neurological manifestations are absent. Treatment: daily dosage of folic acid can be given to the patient. Then we have microcytic hyperchromic anemias. There are three subtypes. The first one is iron deficiency anemia. Reduced amount of iron for hemoglobin resulting in hemoglobin insufficiency is known as the iron deficiency anemia. It develops gradually, undergoing three stages. The first stage is iron stores for red blood cells and hemoglobin synthesis are reduced. The second stage is decreased amount of iron that are transported to bone marrow. The production of red blood cells lacking iron begins at this stage. And the final stage initiates when the iron deficient red blood cells circulates throughout the body, replacing normal erythrocytes. Symptoms of IDA starts appearing during stage 3 due to insufficient iron supply. Other than basic indications of anemia, IDA symptoms include koilonchias, which is Brill's spoon and shaped fingernails, and tongue papillae atrophy, which is just red sore tongue. Treatments include iron supplement therapy, but before starting the therapy, elimination of sources of blood loss is necessary. The second type is sideroblastic anemia. Sideroblasts are the erythroblasts that contains iron granules that have not been synthesized into hemoglobin. It is caused by congenital dysfunction of iron metabolism in erythrocytes because of excessive drug use and toxins. There are two subtypes of sideroblastic anemia. The first one is hereditary. This occurs rarely in males, and it is linked with a hereditary condition called recessive X-linked transmission. And the second subtype is reversible sideroblastic anemia. This condition is associated with alcoholism and thus resulting from nutritional folate deficiency. Clinical manifestations include hemophagocytosis, which is known as iron overload, hepatomegaly, which is just enlargement of liver. It can be mild to moderate, and it also includes enlargement of spleen as well. Treatments include treatments of hereditary is pyridoxine therapy, phlebotomy, and iron overload therapy. And the last and final type of anemia is thalassemia, which is just impaired synthesis of alpha or beta chain of hemoglobin, phagocytosis of abnormal erythroblasts in bone marrow. And the final type is normocytic normochromic anemia. And the subtypes include aplastic anemia, which results in insufficient erythropoiesis due to stem cell proliferation caused by chemotherapy, and treatments can be just basic bone marrow transplant. The second subtype is post-hemorrhagic anemia. This leads to blood loss within body and is caused by increased erythropoiesis. Um, Treatments include increased doses of folate and iron, which can um, start make start which can just induce the amount of red blood cells in the body. Hemolytic anemia is a premature destruction of red blood cells in the circulation due to various reasons. Chronic disease anemia. Cytokines from activated macrophages and lymphocytes suppress progenitor cells, leading to decreased iron in blood. And the last and final slide is sickle cell anemia. It is just abnormal hemoglobin synthesis, unusual cells shaped with risk to damage lysis and phagocytosis. It is inherited and have autosomal recessive trait. And the condition that causes sickle cell anemia is hypoxemia, decreased pH, low temperatures, and decreased plasma volume. And treatment is just bone marrow and stem cell transplants. And these are references, and thank you for listening to our presentation.